First this evening, you've heard of the death toll of COVID-19. The CDC says the virus has taken the lives of over 1 million people.
A new government report estimates that thousands of Americans have died from what's called long COVID since the pandemic began. So we're going to dig into the impacts of long COVID and those potential treatments. So let's start with this right here. Recent government findings.
Nurse Patrice Peretti got very sick with COVID-19 in March 2020. Today, the 62-year-old battles long COVID, extreme fatigue, pain, neurological and memory issues. Eventually, she had to stop working.
I'm going to try not to cry because I was hanging in there. The wave came and the increase in hours, and we were at war, really, and I was injured.
It's estimated as many as 23 million Americans have long COVID symptoms. Now a new report shows more than 3,500 people have died from long COVID-related illnesses in the first 2.5 years of the pandemic.
Perhaps they have a complication, like let's say they have underlying congestive heart failure, and that condition is exacerbated by having long COVID. Or perhaps you have diabetes and your diabetes becomes harder to control.
People 75 and older accounted for more than half the deaths. Dr. Sritha Rajupait directs the post-COVID clinic at Stony Brook Medicine. She says one study limitation is that researchers looked at death certificates and the numbers are likely higher.
I think this is where we have an opportunity to study long COVID further. And so we want to look back and ask, were they vaccinated for COVID? Did they receive oral antiviral treatments? All of those could play an impact.
I go to physical therapy. I do hydrotherapy.
Patrice says she has hope.
I want to say I'm getting better, so therefore I will become better. But today I'm not feeling well. See, so you could have something, a diagnosis that's really, really horrific, but be in a good state of mind.
She wants others with long COVID to know they're not alone.
There is some hope for people who suffer from long COVID. According to the National Institutes of Health, early research might have found the underlying cause of why some people get long COVID and others don't. A team at NYU found evidence those with a history of inflammation are more at risk. Their theory has only been tested on hamsters so far. It needs to be studied a lot further, but one day it might lead to a treatment for long-haul COVID. In fact, another researcher has already developed one option that's been approved by the United Kingdom. It's being considered by the FDA. Valerie Lego shows you how the blood test works.
This is Bruce Bile, and like nearly 7 million Americans, he suffered from long COVID.
No smell or taste, which I still don't have any smell or taste.
In addition to those symptoms, he also had insomnia, fatigue, and shortness of breath. But there was one symptom he found the most debilitating.
The brain fog was just terrible. I would have to write down why I was going to the hardware store because I might get there and not remember why I was there, or I might be driving the car and not remember where I was going. I mean, it was that bad.
And nearly a year and a half after his COVID infection, Bruce wasn't getting any better.
I was scared to death. I thought, God, is this the way my life's going to end?
Bruce wasn't alone. According to the CDC, about 1 in 5 Americans who get COVID suffer from long hauler symptoms. It's a phenomenon physicians are still trying to understand. Dr. Bruce Patterson, a former medical director at Stanford University School of Medicine, believes he may have found the main cause, inflammation already in the body before a COVID-19 infection.
The fact is the underlying inflammation of the blood vessels is what's going on in long COVID and causing, the majority of the symptoms.
Dr. Patterson created a blood test that uses biomarkers to diagnose patients.
And we looked at over 150 different biomarkers and found, with the help of AI, a signature that says this is long COVID.
Dr. Patterson is using artificial intelligence, or AI, to narrow down what's causing the inflammation, whether it's undiagnosed heart disease, fibromyalgia, or another inflammatory disease.
We actually treat the cause. And so when we're done with treatment after 6 to 12 weeks, they don't come back because we've treated the underlying cause of long COVID.
Dr. Patterson's protocol has been approved for use in the UK and is currently under review by the FDA.
We now have 24,000 long hauler patients, the largest cohort in the world, that we're diagnosing and treating because we have the tools to do that.
And Bruce Bile is one of those patients.
The guy literally gave my life back.
Bruce did a blood test and had it analyzed through Dr. Patterson's online chronic COVID treatment center. He then had a virtual visit with his primary care doctor and Dr. Patterson to hear the results. The artificial intelligence algorithm found Bruce had undiagnosed vascular inflammation. Dr. Patterson recommended several FDA-approved medications for cardiovascular disease to treat the inflammation.
And after about a week, maybe 10 days of being on this medical protocol, I started feeling better, and I then continued to feel better.
And after just a few months, Bruce had his pre-COVID life back.
Sounds promising. By the way, doctors have said the more times you get COVID, the more at risk you are for developing long haul. That is why it's so important to stay up to date on your vaccinations, even if you've already had the virus.